of National Defence.
Thank you very much, Mr. Speaker, and I thank my honourable colleague. In times of crisis, the Canadian Armed Forces have always been there for Canadians. At this time, Canadians and members of the forces are mourning the tragic losses of the Cyclone helicopter and the Snowbirds accidents. While these losses are painful, those who serve are continuing to step up for Canadians during the COVID-19 pandemic. Our government continues to make the necessary investments to ensure that the women and men of the Canadian Armed Forces are well supported. Et nous savons qu'aucun danger n'est plus présent pour les Canadiens à ce moment que celui de la COVID-19. Our medical personnel were critical in repatriating about 650 Canadians from China and Japan when COVID-19 first began to spread. La santé et la protection de tous les Canadiens étant l'une des priorités principales de FAC durant cette pandémie. Voilà pourquoi les rangers canadiens soutiennent les autorités sanitaires des communautés des Premières Nations et apportent leur aide aux populations vulnérables, des communautés autochtones, des communautés éloignées et celles du Nord d'un océan à l'autre. The Canadian Armed Forces are also assisting the Public Health Agency of Canada with warehouse management of personal protective equipment and with contact tracing. Through the Canadian Armed Forces response to COVID-19, called Operation Laser, we have deployed over 1,600 members to support long-term care facilities in Quebec and Ontario. As of May 24th, 36 military personnel who were providing support in facilities in Quebec and Ontario have tested positive for COVID-19. They are putting their lives on the line. And because of that, the Chief of Defence Staff has stated to recognize this uniquely hazardous environment, hazard allowance for those directly engaged inside the facilities will be pursued. I want to assure my colleagues that prior to going in, all Canadian Armed Forces personnel have been trained in assisting long-term care residents and have been provided with personal protective equipment. Conditions at these facilities and others across the country are constantly being monitored. That said, we also have to make sure that the women and men who serve, who are protecting us and our most vulnerable, have the necessary critical health infrastructure to support them. This includes investments to modernize existing military infrastructure and to build new healthcare facilities at bases and wings across the country. That's why we continue to advance the construction of the Health Services Centre at CFB Petawawa. While the project has faced delays due to the COVID-19 pandemic, we look forward to the completion of this centre in September. De plus, nous sommes toujours en bonne voie pour commencer la construction d'un nouveau centre de ressources pour les familles des militaires à la BFC Petawawa, afin de soutenir nos militaires et leurs familles. In addition to the ongoing work at CFB Petawawa, we have also completed jetty upgrades. We have a new armory at Saint-Hubert Garrison, a sports centre at the Saint-Jean Garrison, and we continue to modernize existing infrastructure. These investments help to ensure that the men and women in uniform have access to safe and modern facilities in which to work, train, live, and receive care. Thank you.